So what do you think the most important treatments are that, over the years that you've kind of honed in on that might differentiate you from the average oncologist?
Well, I think there's just so many things, okay? But again, I have to tailor it to each patient and what they are able to do, what they're able to afford, because some of my patients can't afford anything. So I go, okay, if you can afford anything, these are the 4 things you need to do, and these are things you can do all on your own.
And you work with people in all different types of situations, whereas a lot of patients might get turned away because they don't fit the mold.
Yes, but I customize and individualize each patient's treatment.
Yeah.
And yes, when patients come in at stage 4 cancer, I need to throw everything at them because their body is completely imbalanced. And so the more that I can throw at them, the better they get very quickly. Because a lot of patients come to me in wheelchairs, having lost 40, 50 pounds from their treatments and unable to eat and nausea every day. So I need to work with them very
intense. Those are the last-ditch effort kind of people.
Yeah, well, I'm usually called, they go, Dr. Connealy, you're my last resort.
And don't you wish you were the first call?
Yes, I do wish I was.
And isn't it true that patients who choose nutrition and integrative approaches first do better than the ones that choose it as a last resort?
Yeah, without a doubt. If I have a patient who has a diagnosis and they only do integrative natural approaches, they do significantly better than someone who's done both.
Yeah.
The outcome is significantly better.
Yeah.
Not to say that some patients might need surgery, might need chemo, but if they've gone through a lot and had their chemo and lots of surgeries and interventions and radiation, their body has been compromised. Yeah,
those therapies are very hard on the body. They're destructive. So it seems like oncologists or even doctors get stuck in a mindset where they stop learning and they think they know it all and there's nothing new to learn.
Right. And unfortunately, medicine is an ever-evolving process. And you need to be learning, unfortunately, every single day. I know in our clinic with our team, we learned something last week that we're going to start new next week.
Yeah.
And so we are fortunately connected to not only doctors and treatments in the United States, we are connected all over the world with doctors. And so we're very, very fortunate because we can bring these treatments that we know. People think if it's just not discovered in the United States, that it doesn't work. Well, lots of doctors are brilliant all over the world.
Right.
I mean, look at Japan, and you look at Germany, and you look at Hungary, and you look at Spain. I've met
even
doctors,
Mexico.
Even Mexico,
yeah,
right. There are doctors that are unbelievable physicians, unbelievable doctors, intelligent, and they know what they're doing. And so we need to bring all these treatments to the patient. And
right.
We need to bring the awareness to them.
Do you think it's easier to do what you do in California versus other states? I mean, to add integrative approaches?
I believe it is, Chris, because California, for example, I'll give you an example. In Los Angeles, there's 34 raw food restaurants, okay? Yeah. Where you live, there's probably not that many raw food restaurants.
Memphis, let me tell you how many there are. This many.
Okay, right. So that means you have to be the chef.
There's a couple little cafes.
So you need to open up a raw food restaurant.
One of my many
But
to-do lists.
in Orange County where we are, there's lots of raw food restaurants.
Yeah.
And plus, there is a juice bar everywhere. In every Mother's, every Whole Foods.
So you think raw food and juice is important?
Yes, absolutely. Absolutely. And so it's available like every mile or two is a new juice bar and a new place to have raw juices and really, really good food. So we're really fortunate. So,
yes, so awesome.
So doctors are, I think, more apt in California to prescribe because it's very accepted, and the patients are demanding it.
Yeah.
And that is what's changing and transforming this movement, is that patients are taking a stand and saying, I'm not going to do this to my body, and I am going to partner with a doctor who can steer me in the right direction. Even
just on a business level, when you realize when the doctors and hospitals and clinics realize that most of their patients are coming in asking about nutrition, asking about alternative therapies and complementary therapies and integrative therapies, all the same thing. And they don't have any. I mean, even just on a simple business level, it's like, hey, we might need to offer these things, right?
Right.
I mean, Cancer Treatment Centers of America is a major advertiser,
Yeah.
and they're promoting the fact that they have integrative therapies and nutrition and all this kind of stuff because they realize this is what people want.
Right.
And I do think that is a great thing, that it's not going to change from the top down. It's going to change from the bottom up.
Correct.
When patients demand nutrition and demand that doctors be educated and informed on health, right? On true health, not just health care. I think that's when we'll see the industry change, right?
Yeah. I tell people you're a holistic system. And so I'm like your quarterback to direct and guide you. And a doctor, no matter what they do, they need to treat the whole system.
Yeah.
So I find that a specialist, they hone in like, okay, if you're a cardiologist, okay, everything's your heart. If you're a gastroenterologist, everything's your intestinal system.
Yeah.
So I always tell people I'm a head-to-toe general medicine doctor who
that's
is
good.
looking at the entire spectrum of illness and the entire spectrum of health and healing.
The whole body.
The whole body.
Gotta look at the whole body because all your systems are connected.
Exactly.
Right? Your immune system, your central nervous system, your endocrine
Exactly.
system. If one of them is failing or malfunctioning, it affects the others.
Right. Exactly.
And the symptom you get may be not because that system is
Broken.
malfunctioning, it may be because of the other. And
Exactly.
with cancer, the immune system is like one of the most critical parts of health, right? Of
Right.
healing and staying cancer-free is a strong immune system.
Right, absolutely. Well, that's the bottom line with every disease, Alzheimer's, heart disease, cancer. It's all about having an optimal immune system.
Yeah.
And that is what's going to heal you, your body. I always tell people, if you cut your arm with whatever, you watch it day by day heal. The insides can do the same thing.
Right.
Because whatever's happening here on your arm is happening inside. And so we don't even think about it. We know that is going to heal, and you can see it daily beautifully heal.
Yeah.
So
yeah.
our body has an innate ability to heal itself.
Yes.
Given the proper direction and guidance.
Yeah. Nutrients, proper care. Yeah, absolutely.
Proper mind.
And you have to make changes in your life, right?
You have to make changes in your life.